Hello, everybody. My name is Patrick Butler. I am the Vice President of Content and Community at the International Center for Journalists in Washington, D.C. And we're very thrilled today to be doing a webinar as part of our continuing series on countries that have been successful in dealing with the COVID-19 pandemic and really kind of looking at what factors have enabled them to have more success than other countries. We've also looked at Taiwan most recently. Before that, we looked at Sweden, which has had a very different approach and arguable whether it's been a successful one or not. And we will continue to do this, this series and look at some other countries, especially in the global south, that are also showing some success. So I'm thrilled today that we're going to be digging into the question of Germany and how it has had really pretty amazing success. And with us is Professor Michael Meyer-Hermann. He is the head of the Department of Systems Immunology at the Helmholtz Center for Infection Research in Braunschweig, Germany. He studied physics, mathematics, and philosophy in Frankfurt, Main, and Paris. And he received his PhD in theoretical elementary particle physics in Frankfurt, Main. So welcome, Professor Meyer-Hermann.
Thank you very much. Hi, Patrick.
Great. Well, we're here, as most of you know, as part of the Global Health Crisis Reporting Forum, which now has about 3,500 members across the globe. If you're not a member of the forum, just search on Facebook for ICFJ Global Health Crisis Reporting Forum and join us on Facebook. I'm pleased that this particular webinar is being co-sponsored by the Arthur F. Burns Fellowships Program, which is an exchange between US and Canadian journalists and German journalists. This is a program that ICFJ runs with our German counterpart, which is the International Journalist Program in Germany. And a special thanks to Dr. Frank Dieter Freiling, who is the head of international affairs at the ZDF television network in Germany and our primary partner on this program. And he was very instrumental in connecting me to Professor Meyer-Hermann. So welcome to the Burns Fellows and alumni who are joining us for this webinar. For those who speak other languages as your first language, you should know that we are also running forums in Arabic, French, Portuguese, and Spanish, with about 5,000 members across those 4 languages, so about 8,500 members in all 5 languages. If you're not on Facebook, you can visit the COVID-19 resource page on www.icfj.org, where you can sign up for newsletters to get news on upcoming webinars and other events. Visit ijnet.org, which is our go-to website for journalists around the world in 8 languages. You can sign up there to receive our weekly bulletin with the latest stories on journalism trends, tip sheets, and opportunities. Now for the webinar today, please remember that you can type in your questions during the discussion in the Zoom chat on the icon below. We welcome you to submit questions. And if you're watching on Facebook, you can post your questions just below the video post. This is an on-the-record discussion, and we will post both the video and a written summary of the webinar on icfj.org and ijnet.org. All right, well, that's enough of an introduction. So let's go ahead and get started with Professor Meyer-Hermann. And I want to just start with the obvious question, a little bit of background here. According to the Johns Hopkins University's Coronavirus Resource Center, death rates for the United States and 4 of the largest countries in Western Europe, France, Italy, Spain, and the UK, range from 46 to 64 per 100,000. Germany's rate is 11. That's a huge difference. And I just want to start with the question of how did Germany manage to protect so many of its citizens when its big neighbors could not?
So we are starting off with let's say, complex question, because actually it is very difficult to find the reason for some development in detail. However, there are some things that may be mentioned in that context. And one that is certainly important is that we started off by testing and tracing rather early. And so that we managed to keep the total case numbers rather low and didn't have a huge wave. We had a first wave, but it was already quite contained because of the early starting. So the time point of really starting with the measures is a critical thing. And so we do simulations of these kind of things, right? And so you can see that if you start off a week later with the measures, you are getting a much higher peak than if you start a week earlier. And so the timing of the measures is something very critical. And so if you think further, the other thing that went probably well in Germany is the information flow from science to politics and back to the population. So that's something that is maybe special to Germany. I don't know why it happened like that. So, but as a matter of fact, the people were starting to already fulfill the measures before the measures were actually decided about. So for example, the wearing of the masks was done before actually it was decided. So we had this opening in April in Germany, and so after the stronger lockdown, we had this opening. And so in the beginning, it was a week of open shops, but without duty of wearing masks. But the people were starting to wear the masks anyway. And so they were somehow ahead of the measures, kind of, right? And this is something that was probably because people understood that it's a serious situation and they have to act. Mm-hmm. And I think this is a major point.
Yeah, and you know, your chancellor, of course, is a scientist herself, and would you say that Germany took perhaps a more science-based approach to the pandemic than some other countries did that were maybe more focused on political questions?
I strongly believe so, and actually, she was asking me for support, and so she's speaking the same. We're both physicists, right? So she's speaking the same language, and even if I say something that is maybe not meant for the general public, she will understand that, and she understands the spirit of what I'm saying. So that actually the interaction was a very positive one, and I think it was influencing the decisions that she was taking, and even she had difficulty. I don't know if you, so I have probably to explain this federal system in Germany, yeah, because you have the chancellor who is somehow supervising the whole thing. But on the other hand, we have prime ministers in all of the different parts of Germany, and each prime minister can take decisions on his own, her own. And so that's something that was bringing up some tension between the chancellor and the prime ministers, because the chancellor was following a very strict path and a clear philosophy, but not all of the prime ministers were following that. So that then different German parts had different rules. Mm-hmm. And so that was kind of a bit struggling. And in that time, also the cases were somehow not so stable. Yeah, but we are back on track now. So
yeah. Of course, we have a similar situation in the United States where governors of different states can pretty much set their own policies. How did that affect Germany in the sense of if one region of Germany had one policy and another region had perhaps a less restrictive one, with people moving back and forth in the country? Italy and Spain and some other countries really tried to prevent people from even moving within the country, but Germany didn't really take that strong of a stand. So how did that impact things when people went from one area that had less restrictive policies to an area that was more restrictive, or vice versa?
It was actually, so the first thing I said why there was a success is that people followed the rules even before they were installed. And so it was the general acceptance of the public that was a major point in that context. Now, if you have different rules in different parts of Germany, everybody says, well, but they do it this way, so why should I do it? Yeah, so it is somehow undermining the general belief that it's right to do this and that measure, and this is overall changing and increasing the infection dynamics, and so that was somehow the major effect, yeah, because people were just saying, okay, now I do my party. I wanted to do my party anyway, so but it's now allowed with 50 people in the neighbor city, so why shouldn't I do it? Yeah, there is no reason. Yeah, so obviously the measures here are stupid. Yeah, so let's just do whatever I want. And so this is kind of not a good strategy. This is why I was strongly pushing that actually we have a more homogeneous set of rules.
Yeah.
So you can do it still differentially in the different parts, but it is important that the rules are the same, right? So, but if you have no cases in a certain region of Germany, why would you then have major restrictions there? No point of doing that, right? So you can, but the criteria according to which you decide about the measures, they should be the same everywhere. So that's somehow the way, and actually I would say it's even in Europe, right? So I would go a step further from there. So what we didn't really manage to do in Germany and the different federal states, I think we should have done it in whole Europe and have a common philosophy of how to set up the measures in whole Europe. We didn't manage to do that. For me, it was a mischance of European politics.
Do you think it's even possible given countries' autonomy within the European Union, or could it have been achieved and just lacked leadership, or do you think it's just impossible?
No, I don't think it's impossible. So maybe I'm idealistic. I think it would require that people accept a panel who is making recommendations, and then it could work out. But I agree that it's difficult. So, but people were not so far apart. Actually, the difference between the different countries in Germany, in Europe, is more about the dynamics rather than about the general philosophy. So in the beginning, Sweden was a bit different because they talked a lot about herd immunity and now accepted meanwhile that it's not possible. But but otherwise, the general philosophy was not so different. So I think we could have done it in a more unified way. And then also the closing of borderlines for traveling wouldn't be necessary anymore. The only reason why we close the borders is because the infection dynamics is different on the other side of the border. So why would I do that? If we have all the common philosophy of how to deal with the situation, then we can just open all borders again.
Were there any areas where you felt that Germany didn't do as well as it should have?
Well, so you know, it's still a pandemic, and so there was a lot of harm. You know, it's not about not only about the deaths that we have had. It is also about companies that went bankrupt, and it's if you look in my background, I'm in a family of artists, and so the artists were just not gaining any money anymore. So if you are a singer or something, so an opera singer or something, you just have zero income, so nothing. So it's nada. And so this is something that is very difficult to protect from. And so there was still a lot of people suffering from the situation. And I don't know if we could have improved it and how. Yeah, and maybe if we would have done the measures even earlier than we did, maybe the wave would have been a little bit more contained, and maybe everything could have been kept more open. Also restaurants, I'm not sure that we needed to close the restaurants. So in the end, so it could be that it was not necessary. But this is actually a difficult thing. You know, we talk about Bayesian inference. So we try to see all the different cases and then to see which measure was actually necessary. Because we don't know which measure was doing what. Yeah, so it's a mixture of everything. And so how to disentangle that, it's really difficult.
Right. Interesting that you bring up that idea of the restaurants and the closing. Two points there. One is Germany also got a lot of credit for its economic support for businesses that other countries did not have, and for people who were not out of work. How do you think that went in Germany? Do you feel like that helped prevent some of the economic misery that might have happened otherwise?
Definitely that helped a lot. And so what I think is an important understanding of the situation that is also probably not there in US as I see it from outside. I'm a bit careful with that statement. So I was publishing a paper together with the IFO Institute. So it's an institute of survey of economy. And so what we came up with a conclusion is that actually economy and health have the same interest. So on the short term, it seems like a contradiction. right? So because you close the restaurant, so the restaurant is in difficulties. Yeah? And you do it in order to contain the virus. So you give a priority to the virus, you could argue. Yeah? But if you think on the long term, people will not go to the restaurant if it's open and there is the risk of getting the virus there. And so if you think on the long term, it is just the same interest. We have to contain the virus so that we can have an active economy and a secure health system. So this is the same direction to go, and to have the right degree of measures, not too much, but such that you can contain the virus and still open the economy. This is the way to go, right? And long term, the costs of having a second lockdown would be amazing. Yeah. So then this kills everything. If you have a second lockdown, this is not possible to go over. Yeah. So.
Well, that brings up another question. Do you think that we may face a resurgence that might require a second lockdown, both in Germany and other places, especially as cooler weather comes in the Northern Hemisphere, people spend more time inside? Mm-hmm. Do you anticipate that happening? And if so, could that require a second lockdown, or at least more restrictions in place?
So I'm even modeling, you can do predictions, but this is just predictions that you can do for the next 3 weeks. And so the long-term thing is much more difficult and depends on many factors. And so I cannot give a very clear statement on that. But what you can see is during the summertime now, in Germany, now talking about Germany, so people were traveling, vacation, right? Mm-hmm. And so they were bringing back the virus to Germany, and we were going back from 200 cases per day to 2,000 cases per day. Mm-hmm. So a factor of 10. And so the interesting thing about that is that, according to a colleague of mine who did the simulation, Anita Schöbel, she was saying that this increase in cases was mostly just because of people coming back from holiday and not because of a changed behavior in Germany. So the dynamics within Germany were the same as before, or maybe a little bit different, but not too much, so that after the wave of people coming back is over, things are relaxing again. Yeah, so and going, so asymptotically going into the same state as it was before the vacation time. And so this is one thing that we have to be aware that we can learn two things from that. One is the virus is there, so if you bring it, it will expand. The other thing is the measures we have are able to contain it. But as you say, if we are now staying inside and being in closed rooms, and most of the infections happen in closed rooms, then it will have an intensified dynamics of viral infections, so that the whole thing will start again. And the question is whether we are able to contain it without another lockdown. And this is really hard to foresee. But we have to be aware that it will come, and we have to be prepared. So the whole tracing and testing is a major thing, but we have also to be aware that it's not sufficient, right? So tracing and testing and isolation, these three things work perfectly in Japan, for example. So even without testing, so just tracing and then isolating everybody who had contact. So that's a thing that worked perfectly, but it brings down the reproduction number by a factor of 2. So if we start by 3, at 3, so we end up in 1.5. So we are still above 1, which means we have still an exponential growth. So we need more than that in order to really contain the virus in that situation. So we will need to combine the tracing and isolation strategy together with continuation of mask wearing, in particular in closed rooms, and having a little bit of fresh air from time to time. Yeah.
So let's go back to the testing and tracing that you talked about as one of the strategies that was so successful for Germany. Tell us a little bit more about how Germany did it. I know there were some apps that people were using to, or I guess the officials were using to track people's contacts with other people. How did that work? How did that work with privacy concerns? that sort of thing?
So if you're talking about the app, actually, that is not the part I would consider to be a success story in Germany. So it took so long that actually the first wave was over when the app was finally released. And this was because of a very strong pressure from the side of protection of human rights and individual rights. So there was lots of discussions, and actually the strategy was changed at least 2 or 3 times on halfway, so that people started developing and then stopped again, new strategy. And so it took ages. And it was finally released, I think, in May. So everything was already contained there. So that was not a really brilliant story, I would say. Okay. But having said that, now that it's there, so I have it on my mobile here, so it's there, and now that it's there, even though there is only a small fraction of people really using it, a small, I don't know the last number actually, but it's still growing. So it helps if the people were there. It is picking some people who are getting into isolation earlier, a few days earlier than if you would just do it by talking stories about whom you met. And so it's also very uncertain. So that helps. And every contribution, so this is a way of thinking, you have to actually think that it's not, you have to have a perfect system, right? So that's not the goal. The goal is not a perfect system that is catching everybody. The goal is to reduce. And you reduce, and if you have sufficient little measures and everybody's contributing to reduce a bit, you are ending up with a reproduction number below 1. That's sufficient, right? So the app is having a contribution to that. And in that sense, it's useful now in order to go for the next round and to see what happens if we are in the closed rooms.
Testing, another big problem that we're having here in the United States is the length of time it takes to get test results, which makes tracing very difficult, because by the time you find out that you are positive, you've infected many other people, and tracing comes a little late. Germany, how long did it take you to get your results, and how were you able to achieve a quicker test result?
It was faster with time because the whole process was somehow getting fluent. But in the beginning it was 48 hours, now it's more 24. Mm-hmm. But even that, so I can cite my simulations. If you look at the simulations, with the knowledge about incubation period and when the virus starts replicating in the patient, the effect of testing is really not big. So that's not a way to go as long as it takes 1 or 2 days to get the results. So exactly what you say is true. So either we go for fast tests, right? So that's, there is fast PCR tests and also antigen-based tests. They are less sensitive. The antigen-based tests are less sensitive, but it's still better because you get the result in 20 minutes. Right. And so with that, you can actually think of a residence home, right? So the people working there can do the test right before they go through the door. And by that, prevent bringing the virus into the resident home, which is then a disaster if it's there, right? So because you cannot control it. And so this kind of things, even if there is a risk that remains, it's still better to have it like that, or better than to have the test after 2 days. So that doesn't help at all in this. I don't care if I had, so if I had the test 2 days ago, I can be sick now, right? So this is, so that is not helping in that instance. So the testing is a difficult topic, and also the capacity of testing is a limitation, also in Germany. And so my philosophy in that is more the Japanese way of doing, just trace, isolate, and if you want to get out of the quarantine after 5 or 7 days, you can do a test, and if it's negative, you stop the quarantine. It's a way. So the testing would be somehow in order to deliberate from isolation, but not in order to decide whether to go to isolation. So you go to isolation by default, and then you can go out if you have a test that is negative.
Okay.
So this is the way to go. And that would actually be an effective measure.
And that requires compliance. Both tracing and isolation require compliance. People have to be willing to tell you who they've had contact with, and they have to be willing to isolate. And as you said earlier, Germany did very well on the compliance question initially. We have started to see some protests in Germany, including a couple weeks ago, the right-wing groups at the Reichstag. Do you see that is that just a small group and not really important, or is this a growing movement to protest against wearing masks and giving up my contacts and tracing and things like that?
Well, it's not really surprising that it happens, right? So the right wing is actually taking every occasion to sit on something and to take advantage in order to do some more propaganda. So that's not a new thing neither in Germany nor in other countries. Meanwhile, luckily, and it's not a German special thing anymore.
No.
And so this is something that I would have been surprised by this not happening. And also, if you think of other pandemics, you have also always have these people who deny that the virus is existing and have some conspiracy theory and how this all so Bill Gates was inventing it, right? So this kind of things. So you have these movements all the time. So this is actually harming a bit the infection dynamics, because those movements, they don't wear masks. So they go on the street and are narrowly together, and then they don't wear masks. So there will be infection dynamics induced by this movement. But the containment that we have overall the country should be enough just to tolerate that. And so this is why I'm not so much stressed about that.
Okay. Well, that's a relief. I'm glad to hear that. What about schools? Obviously, we're at a point now in our countries in the North where students are returning to schools. Mm-hmm. Germany has, again, had some pretty successful return to school with some outbreaks, but action taken pretty quickly when there are outbreaks. Do you feel like it's going well, the return to school? And do you think that it's something that is necessary given the advantages of being there in person over having to do it online, which of course has many disparities in terms of who has access and things like that?
So school is a very difficult topic for me because I was very nervous about it. And the point here is that we actually don't know exactly about the transmission dynamics in the youth. And so we don't have enough information to really say. So we know if they get sick, they get less symptoms. So this is what we know overall. There might still be long-term effects that we shouldn't neglect. Yeah, so it's not that every youth should become sick, because we are not sure about long-term effects now. And there is some hints that we don't want to have. And in that sense, yes. So what is about the transmission? So if they are getting less symptoms, are they less transmissible? So are they less infectious to others, right? So is that the case? So if that was the case, we could actually be a little more relaxed about bringing them to school, because transmission dynamics in the school wouldn't be the same as, for example, in a meat facility, yeah, and as we have seen, and so it's a difficult thing there. And on the other hand, you have to look at the contact matrices. So there is you can go in every country for that. So it's just a peak in the school, right? So they have just many more contacts, and real contacts. They are just hugging all the time and do whatever they do, right? And so many more contacts than in any other part of the society. So even if they are less infectious, there is still a big danger because of the number of contacts. And so for some reason, I don't know, and it's interesting that it happens like that. So far, the cases that have been identified in school didn't develop into a kind of little pandemic, little super spreading event in the school. So, and it was sufficient to either remove one school class and isolate one school class, or even just the neighbors sitting together in the school. So it seems to work. And so if it's working like that in Germany, I think other countries can do the same. On the other hand, if you think of China, they didn't reopen the schools so early, right? So this is they were very careful about it. And so there is plus and minus here, and it's really difficult to get the right balance to make a definite decision of whether this works or not.
Okay. There was a South Korean study recently that showed that I think it was around age 10, there tends to be a difference in transmissibility. Younger children don't transmit as much as, you know, preteens and teenagers.
Yep.
Are you seeing any evidence of that in Germany in terms of the return to schools, that when there is transmission, it tends to happen with older students?
So I don't see any statistics that would support that.
Okay.
But it's plausible. Yeah. So I think it's plausible that it's like that. And
okay.
yeah.
That needs more study then.
Yeah. So we cannot say it. So it's one case. And so, you know, the statistics are not so huge. So if I count the cases that have been here in Germany, it's still just a few. So if you put a standard deviation, it's just whatever you want. Yeah. Right. So.
I want to remind everyone that we welcome your questions for Professor Meyer-Hermann. If you're on Zoom, just type your questions into the chat. I'll be taking a look at those shortly, and we'll pass some of those on. If you're on Facebook, you can also type your questions in the chat there, and my colleagues will add them to the chat here on Zoom. So please do send your questions. I also wanted to ask you a little bit about other parts of the world. Of course, much of our audience comes from the global South, Africa, Latin America, South Asia. And Germany has had a great deal of success, but of course it's a country with a lot of resources. Do you feel like any of the things that Germany did well are adaptable to countries with fewer resources than Germany has?
Well, so if I think back to my first answer, that a big part of the success and the containment in Germany is about information that is going from science to politics to the population. This is not very expensive. That's nothing that you couldn't install somewhere else, even though it might be difficult in some parts of Africa, for example, to reach every citizen. And to really inform the person about the situation and about the correct behavior. So I see that might be a difficulty that is bigger than in Western Europe and US, where you can just reach everybody by social media. And so there is a difficulty there, but I think this is not expensive and you can install it everywhere. And so that's something that I don't see a problem. However, if you think of India, so that's a real disaster there. So in my working group, I have 3 Indian people, and they are just trying to support, but it's impossible because people are so dense and all generations sit together in a very narrow manner, so it's very difficult to protect the elderly, right? So because they are just living in the same region and on a very close room, and so that yeah. And
have you seen any examples of? I'm sorry.
It's an unlimited growth in India right now, so it's just amazing. Have
you seen any examples of countries in the global South that you think have been real success stories?
I don't know about those in Africa, but I know that in Africa in general, the viral spreading is not so dramatic as in other countries like India. So.
All right, I'm gonna take a look and see if we have any questions yet. But while I do that, I wanted to ask you a little bit about vaccines. I know you're not a vaccine developer, but Germany is a leader in the search for vaccines. Do you have any thoughts on how soon you expect to see that in Germany and what the impact is? A lot of people are looking at vaccines as sort of a miracle. Then it's all going to go away as soon as we have a vaccine, which may be a little bit Pollyannish, as we say.
Yeah. So the story of vaccine is a very difficult one. So I don't think it is a limitation to develop a vaccine right now. And so you see already many vaccines that are there and that are being tested. However, the question, so if you normally bring a vaccine onto the market, it is not something that you do within a few weeks. Yeah, so this is not a time scale. You have to test, you have to see whether there is any side effects, you have to see whether actually protection is effective. And now if you go to that part, there is some peculiarities of that virus that are, let's say, inserting some doubts about that part. Because, for example, people who have had a severe infection and have died afterwards, if you look into the lymph nodes of those people, you don't find so-called germinal centers. These are specialized parts of the lymph nodes where you develop new antibodies that are then being of high affinity for the virus. So typically, if you have a viral infection and you should be full of those germinal centers, and they are just not there for some reason, which means that the antibodies that are being eventually generated in those patients are just short-lived, likely. Yeah, so I'm speculating a bit here. And if they are short-lived, it means that the antibodies will not protect for a long time. So now in vaccination, you might induce maybe more, because maybe the B-cell part, so the antibody part is not working well, so you can go for another line and try to make more a T lymphocyte-based response. So people are testing all these kind of things, but we don't know exactly about this immune responses, and we don't have sufficient information to really be sure that the vaccine will be a long-term protection, at least for a year or so. So like in influenza, that you can vaccinate every year and hope, but even in influenza, protection is sometimes just 15% or something. Right. Yeah, so.
And of course, the flu vaccine changes every year based on what strain scientists expect to be dominant.
So the mutation frequency is not yet known, right? So there is some mutations that are there and that seem to become dominant, but yeah, so this is, we don't have sufficient experience to see where this goes.
Okay. We have a lot of questions from the audience, so that's great to see. So staying on the topic of vaccines, from our audience member, Annalisa Quinn asks, Germany has a stronger anti-vaxxer movement than the US and many other countries. Is that a concern as the vaccine gets closer to reality? And how much of, I'll add my own follow-up to that, how much of that is sort of the anti-vaxxer, anti-science conspiracy, and how much of that is perhaps legitimate concern that we're rushing on the vaccine and it may not be safe?
So I don't feel that it's, so let's start the other way. In a few months ago, we had 50% of people who were willing to be vaccinated if a vaccine is there. This went down to something like 20% or so now. So yes, there is a kind of skepticism, but maybe this is also related to the fact that we are now containing the virus and the necessity to become vaccinated with all the question marks that are associated and the unknown side effects. So you would go for a vaccine and really want it only if you feel a real danger. And this is not the feeling that we have right now here. So that this might be a big part that is influencing the opinion of skepticism, yeah, in Germany at least.
Are you, a lot of people feel we have to get to a certain level of vaccinated population to achieve herd immunity, and if we have a lot of people hesitant to take it, that we won't get to that level. Is that a concern, or is that not really?
I'm very skeptical that we will have a vaccine that will induce herd immunity. So not only because people will not all become vaccinated. So the problem already is if you have a vaccine that is considered to be secure and efficient. So that's two things we have to know. So if we have that, we have to produce it, and who is getting it in first place. So already there is a decision to take. And so we will not have this wave of vaccinating the whole population and then having herd immunity. And then the question is, how long is the immunity lasting, as I was describing before?
Right.
So even that is not known. And in view of that, maybe this is not a way to build on. So maybe we are having a good situation, we get a secure and really efficient vaccine that is inducing immunity for a year, and this will be there in January or March. So possible, yeah, but we cannot build on that because we don't have it now, and we have no clear path to know that we will have it.
Mm-hmm. That's sobering, but important to hear that. I think a lot of people are counting on that to change everything. All right, more questions here. This one is from Eric Herbst. What is your assessment of the Trump administration's response to COVID-19?
Okay.
A fraught question there, but if you're willing to take it on.
So if I compare, so I will try to be kind of friendly. So if I compare the relationship of Trump and Dr. Fauci to, for example, Angela Merkel and myself, I would say there is a big difference, because the one relationship is obviously a constructive one, and the other one is kind of not being a scientific exchange. Mm-hmm. And so I would think that it would have been possible to make things better if the communication between the two would have been a bit more intense.
How often are you in communication with the Chancellor? It sounds like you're a pretty close advisor on this question.
We have a meeting every 2 weeks.
2 weeks, okay, great. Another question from the forum comes from Jim Berklin, and this is about nursing home or as you called them, residential facilities, I think. In many countries, including the US and others, COVID deaths related to nursing home personnel hover around 40%. What is the experience in Germany, and what are any specific policies followed with regard to keeping nursing home residents safe and or locked down? I'm not sure about that statistic. Deaths at 40% seems a little high to me, but I don't know.
I don't know that either. But in general, I can say that it's a major concern because we know about those, I would call it a hub, namely that the nurses are in contact to people who are particularly vulnerable, either because they are old or because they are sick or have other diseases. And in that sense, this is a really important issue to take care that the people who are helping there, so the nurses, are not infected. And this is something that, so in Italy, what the person, I forgot the name, sorry, was describing was a major issue in the beginning. Yeah, so because, so someone was getting symptoms, and in Germany, you go to the so-called house doctor, and the house doctor tells you to stay home. In Italy, the person was going to the hospital.
Okay.
Yeah, and so was spreading the virus in the hospital. And that was part of the disaster that happened in Italy. So I think it's a very important point that was raised here, and it is particularly important to take care of that very consciously.
Yeah, I remember when we had Dr. Anders Tegnell from Sweden on and doing a webinar, and he mentioned that he was very much defending Sweden's approach, which is much about, as you said earlier, trying to get to herd immunity in a natural way. But he said where they fell down was protecting people in nursing homes that didn't do enough to protect them, and that was one of the reasons Sweden had such a high death rate. Germany, I think, did better in that way, would you say? Protecting its most vulnerable?
Yeah, so for one part of that, but that's not a difference to Sweden, but maybe to Italy, is that the generations are not living so much together in Germany. Mm-hmm. So it's more on the level of US. So I think the statistics say something like 6% of the people live across generations. So that was part of why I think in Germany the elderly were kind of protected more easily than in other countries like Italy, but it wouldn't explain Sweden. But Sweden was kind of letting it go, as you say, to some degree. And this is maybe dangerous in the view of the dark number, the so-called dark number. So I think one part that was making Germany kind of controllable is that the dark number is comparably low to other countries.
All right, let's go. We have many more questions are coming in. And this is one that takes a little bit of an optimistic take, perhaps, from Sarah Fawkes. Do you think the pandemic has or can have a long-term positive impact on the relationship between science and politics and public understanding of science in Germany and elsewhere? So a shift that might support activity on other issues like climate change.
Yeah, I was just going to mention the climate change. That is a positive effect indeed. I think it already did. So that was already, so there, you can have to imagine that in talk shows in Germany, for the last 4 months, there was hardly a talk show without a scientist. And you can ask a year ago whether there was any scientist at all. So I think there was none. Maybe someone who was discovering life on Venus would have been invited to a talk show, but nobody else, right? So this is nothing that happened. And so the science and the scientists were already carried into the public communication. And yes, this was actually also an assessment of one of the talk show masters was already saying that she hopes that this will persist beyond the pandemic, that the interest of the public into scientific thinking and scientific knowledge is kept on the level as it is now. So yeah, I would share this optimism.
Another potentially optimistic point that I also wanted to bring up is this will not be the last pandemic that we face in the world. And this one perhaps has awoken us to the potential danger. And do you feel that in the future we might be better prepared when another pandemic hits? Or does our tendency to just kind of, okay, that's over, we can go back to normal?
No. So it will have an impact because, I can now speak for Germany again. So in Germany, there is a lot of money that is spent now for projects that are helping in keeping this pandemic controlled and now the important part, and establishing methods that are transferable to other pandemics. So this is directly preparing for the next virus. Yeah. And so we have to learn what we have to do in this situation, and we have to be prepared for the next, identify the next pandemic and contain it before it is a pandemic. This is the two things we have to do, and to install the measures to really react quickly. And this is certainly only possible if the whole world is doing the same thing, right? So because as we have seen, the virus is everywhere, right? So right. Within a few weeks.
Another question from Ryan Delaney, who has a follow-up on the schools question. Would you recommend more health measures for schools and students going into the fall in our Northern Hemisphere, such as attending on alternating days or requiring masks in class?
So this is, I would go the other way.
Okay.
Namely, so as it looks like now, school opening was not a major problem, which is surprising to me. So I was not predicting that. And if it works, and if it's fine to some degree, and we can react to single cases that happen to be there, then I think this is sufficient. It's not changing. I don't see any need to adapt the strategy. So I would keep it as open as possible. And this is a kind of learning process that we have, and which may also depend on the season. We have to see that, as the claim could be that we have to change our philosophy in fall when it's getting colder. So it is, for me, it's a big problem that children will come up with a normal flu, a normal cold. So they have symptoms. So what are you doing with this person? Yeah, so what are you doing with this pupil? Do you send him to school? Difficult, might be COVID. And
right.
Yeah, and so you need to test first and have a negative test, and then you can send back to school. So then half of the school will be empty. So this is the problem we have to solve to probably, so the need is to identify which virus do we have here and do we have to react or not. So I see the problems there. So it's back to the testing thing.
Right.
Yeah? So the vision I have, which I don't know if it will be there at some point, is you clean your teeth in the morning and you do a test, and then you go out
daily.
That would be a nice thing. That people are working on that kind of thing.
Right.
As well. I don't know when it will be there, but so this is something that we can maybe install on the long term at least.
Great. Another question from Annalisa Quinn, which was also on my list, to talk a little bit about the role of the news media, since we are a group of journalists here. In Germany, how do you assess how the media did there in terms of helping to communicate to the public? And if you have any sense of it, other countries such as the US?
I cannot tell about the US. I'm watching CNN from time to time.
Okay.
And so this is not sufficient in order to make a major statement on that. But yes, the media were helping a lot in communicating. So in the phase where we had a stronger lockdown and the discussion of whether we open or not, and whether we should open the shops or maybe not, and open it with some constraints or maybe not, and limit the number of people. So in that phase, it was quite a strong communication via the media, and they were approaching many scientists and many politics, including me. So no, I'm not belonging to the politics, but the scientists. And asking for the opinion. And so the positive experience I had is that all the journalists I was talking to were constructive. They were not trying to cheat me in a way and getting some statement out of me that is then turned around in my mouth or something. That's so the reputation of journalists, right? So this was not happening at all. So everybody was trying to judge the situation and to help. And this was an amazingly positive experience for me. Great. So yes, I think media were playing a big role and a positive one.
I'm very glad to hear that. All right. Well, we also had a question on people who are asymptomatic. And the sort of, this was from Disha Shetty, asymptomatic patients continue to be a huge concern. How did Germany test these patients, and was there any community spread through asymptomatic people?
Yeah, so actually the whole problem is about asymptomatic people. So yes, this is well on the point. We wouldn't have this pandemic if asymptomatic people were not there. And maybe we have to also define what asymptomatic means, because most people have some symptoms, but they are just negligible. And so they are never asymptomatic. So I don't know even that, but it's for sure. But what people think is that asymptomatic people are still having viral growth, so that experiencing viral growth, so that they are actually infectious. And this is the problem, that they will pass the virus without knowing that they were sick in the first place. And yes, so this is why we have asymptomatic people in our simulations. And this is why we have so much difficulties to bring down the pandemic, because there is too many people who we don't recognize and where we cannot do any isolation. And that's the only solution I have to that. There is no possibility. You cannot test everybody. Yeah, so it would be the only, so one way would be testing everybody, but forget it. We don't have enough tests to do that. So no way of doing this. So the only way is to do the tracing and define clusters of people if you have identified a sick person, so that every potential person who can be sick is isolated for a certain period. So define the cluster larger, so you will catch the asymptomatic in this cluster. And this is the only way of getting, and this is why the dark number is such a critical point. Yeah? So because the dark number, if it's getting too big, you're losing control either. Yeah? So the tracing and isolation strategy only works if you have not such a big dark number.
Another question about one of the things that we seem to be discovering as this epidemic wears on, or pandemic wears on, is that even people who had mild symptoms can have long-lasting effects in terms of, their lung capacity and things like that. Have you looked at that at all, and what are you seeing there?
Yeah, so I have looked at that, and so what the definite statement is that I can make is that we don't know enough about it, but the number of reports in this direction is increasing, and but it's actually maybe not so special. So you can find the virus in the brain, and but you can also look at influenza, and you will find concentration problems 3 months after influenza is gone. So there is a common thing there, but maybe the point is that the point of entry for this virus is the ACE2 receptor, and you find it in different organs of our organism, and in that sense it is affecting different organs and infecting different organs, and can have detrimental effects there. Yeah. So that's why it is not a pure lung disease. Or respiratory tract disease. So, but it is going beyond that because this receptor is expressed in other parts of the body.
Right. Okay. Well, that's, I think we're about at the end. And so I want to, first of all, ask you if there's anything we didn't talk about that you think is important, anything you'd like to add before we wrap up?
That's an interesting question. I think that we did a good tour so far. So my major concern, that's actually not a topic to discuss, but maybe more a statement. My major concern is that we kind of find a unified way to deal with this pandemic, not only in Germany, not only in Europe, but all over the world. And we have to find a solidarity that we all try to get this controlled in a way that we can continue our lives. In a way that, not necessarily in the way we did before, maybe we can get some positive effects out of that, as some optimists here in the audience were already saying. Right. So maybe we can take that with us, but otherwise we have to have a big solidarity all over the world, and we have to take that as a chance to help each other.
Which brings up one last question, which is the World Health Organization. How do you assess the role it's played, and of course the US not cooperating with the WHO anymore? Is that a serious problem?
I was a bit shocked when I was reading that news, so it's already a while ago. And, yes. So I don't understand that philosophy in a way, because what can we do? So we can just close up our country and then think that we can solve our problems in the country, but this is not a problem of a country. It's a problem of humanity. So the only chance to solve that is if we all stand together and help. Yeah, and so to somehow exclude yourself and do your own thing just because you think the World Health Organization is not doing a good job, or whatever the reason was, I don't understand that. So it's the contrary of what we should do.
Yeah. All right. Well, I want to thank you very much, Professor Meyer-Hermann, for being with us today. This was incredibly educational for me and for our audience, I know. So thank you for taking the time to do this. I know you've done this many, many times, and really appreciate you speaking now to our global audience. I also want to thank Frank-Dieter Freiling, our partner in Germany, for his help in setting this up, and the Arthur F. Burns Fellowship Program, which is co-sponsoring this webinar. I want to encourage everyone to watch the ICFJ and IJNet websites for a write-up and video of this webinar, which we will also be posting on our YouTube page. That's icfj.org and ijnet.org. Please invite your colleagues to join our forum. We also remind you that we will be sending you a survey about this webinar, all of you who participated, and we ask you to fill that out because your feedback is very, very helpful to us as we plan additional webinars in the future. And remember to look for us on Facebook, ICFJ Global Health Crisis Reporting Forum. And finally, I want to invite everyone to attend ICFJ's online Tribute to Journalists 2020 awards event. We'll be holding that October 5th, beginning at 7 p.m. Eastern Time with a pre-show. If you can't attend the live event, because obviously for many of you, time zones are not going to be very friendly for that, we invite you to check out our website the following day to watch the tape. This is our annual event where we give out awards to really amazing and inspiring international journalists. This year from Egypt and Russia, as well as Fareed Zakaria from CNN and the Washington Post. It's a really inspiring event, and for the first time, it's free and open for anyone to attend because we're doing it online. So we do encourage you to check that out. You can get details of that, again, on our website, icfj.org. So thank you again, Dr. Meyer-Hermann, and thank you.
It was a pleasure
For joining us.
Yeah, it was a pleasure.
All right, we'll see you next time. Bye-bye.
Bye-bye, and stay healthy.
Thank you, you too.